So this is not the time I would have chosen to make a video. I look horrible, but this is not the point of the video. I saw a post. So let me rewind. I'm a social worker. I have been a social worker. I graduated from grad school in 2015 from one of the best clinical social work programs in the country. And I was very fortunate to have the best clinical internships. Many of my jobs have been in hospitals working with the most acute patients in the state of New Jersey. So I've seen it all. I've also been extremely fortunate to work alongside some of the most incredible APNs and psychiatrists. I even worked alongside a psychiatrist who worked with Mnuchin himself, which is like the godfather of psychiatry. And so while many social workers are not really well versed in medications, different classes of medications, medication management, I've been fortunate enough to be surrounded by that in my entire career. So I know a lot, I feel. And so I came across a post tonight that really disturbed me. And this is where I'm going to go on my rant. Because I want people to be educated on medications, and specifically if they are on medications, to be educated and know what questions to ask and what questions to ask their prescribers, and at this point there are so many people being prescribed antidepressants and anti-anxiety meds from their just regular physicians, primary care doctors, and not a psychiatrist or someone in that field. It's sometimes easier to get your meds from your primary care physician than trying to wait months to get in with a psychiatrist, or it's cheaper because it's going to be a lot of money to get in with a psychiatrist, or you're going to be waiting for months to get in with a psychiatrist. So I get it, but I just don't think the right information is being passed down for people to know what they're on and what questions to ask. And that is just appalling to me as a practitioner myself, because I want people to be informed. I want people to know, and they have the right to know what questions to ask about their own care and their own health and their own medication regimen. And so I don't even know where to begin with this post. I feel like this post is going to go in a million different directions. And I could make 3 different videos on probably everything I'm going to cover in this video. And I probably will make sub videos on everything I post in this video. But let me just explain. So there's 2 different classes of anti-anxiety and antidepressant medications. You have, there's a lot of different classes of medications, but you'll commonly hear SSRI, which is selective serotonin reuptake inhibitor. Basically, all these fancy terms are fancy ways of saying how this particular medication is being absorbed and metabolized in your brain. So commonly you'll hear SSRI or SSNRI, which is serotonin norepinephrine reuptake inhibitor. So very similar, but different also in a lot of ways. So the post that I specifically saw was about a generic version of hydroxyzine. So hydroxyzine, also known, oh my God, I'm gonna mess this up. It starts with an A. I'm blanking on the brand name of this med. It may come to me at some point in this video, but it's basically a souped up version of Benadryl. Like if you were to take, you know, a little bit more Benadryl than you were gonna take, that's pretty much what hydroxyzine is. And a lot of times it helps with like minor agitation, anxiety, minimal, like not for anybody that's having like panic disorders. I don't think it's really gonna work for that. But you know, I just think it's important for people to know name brands, generics, what your insurance company could pay for versus what they're not paying for, what tests you can have, all those different kinds of things. I've seen personally a huge, massive increase in providers prescribing Effexor. The generic, if I'm remembering correctly, the generic of Effexor is venlafaxine, something of that sort, which is an SSNRI, meaning it's a serotonin norepinephrine reuptake inhibitor. And Effexor, and what a lot of people do not know, is it has some serious, really awful side effects. Now, will everybody respond the same way? Obviously not. I'm sure there are some people that can take Effexor and be fine. It's with anything, you know, any of this is going to have a huge disclaimer because your body is going to be very individualized and react specifically to a certain type of medication. But overall, Effexor, I just feel like has the worst side effects. And I'm, as a social worker, hearing like my friends constantly being recently prescribed Effexor. I'm like, why are they prescribing that to you? Like, it has some of the worst side effects. Now, all medications have side effects. A lot of antidepressants, anti-anxiety meds have side effects, but Effexor in and of itself, I feel like has some of the worst. You know, and so what I put in my post is I feel like people need to be educated on the fact that there are certain medications which, regardless of what class of medication they're in, have what's called a short half-life versus a long half-life. So Effexor and Prestique, which both actually are SSNRIs, both used to treat depression, anxiety, have a very, very, very short half-life, meaning if you take the medication at 8 o'clock at night, you realistically should probably be taking that medication at 7 p.m. the next day, because it's got such a short half-life that within 24 hours, it's already leaving your system. It's already creating those withdrawal side effects. So you're going to feel nauseous. You're going to feel sick. You're going to feel like you need a gag or just not well. And so a lot of prescribers don't talk about that. A lot of prescribers, I feel like, neglect to tell their consumers, which I hate that word, but consumers, about the potential side effects. Whereas Prozac, which is like a tried and true, it's been around forever, everybody's heard of Prozac for the most part, is going to have what's called a long half-life. So if you've taken Prozac consistently for 3 to 4 months, you could probably skip a week, even probably 2 weeks of taking your Prozac, and that Prozac is still going to be in your system, still releasing some of that medication to kind of keep you at this equilibrium. Whereas a medication with a short half-life is going to metabolize through your system very, very quickly. So if you don't take it at the exact time each day, or even a little bit before that exact time each day, you're going to feel so sick and you're going to feel those side effects. So I had a friend who had posted on her Instagram like like a poll or a question or something of that sort, just kind of speaking to, has anybody like had these side effects before? Has anybody experienced this before? And I messaged her and I said, did your doctor talk to you? Because I knew, I think she had said what medication she was on, which was Effexor. And I said, did your doctor talk to you about the side effects of Effexor and the fact that it has a very, very, very short half-life? And I explained what that meant to her and what side effects may come from that, what may come from having a medication with a short half-life. And she was like, oh my God, this makes so much sense. My doctor never talked. Now, you gotta understand, I'm a social worker. I graduated from a very good grad school. I went and got my license. I'm qualified to have my LCSW. I just haven't really gone that route yet. But these are these are psychiatrists who have gone and gotten their MDs, who are not telling their clients about these side effects. So she's like, oh my God, this makes so much sense. And went to confront their psychiatrist, and their psychiatrist is like deer in headlights, or denying the fact that they did not disclose what a short half-life versus long half-life versus the side effects were of these medications. It's mind-boggling to me. It's mind-boggling to me, like, that this is going on. But people, I can't fault the people because they don't know what questions to ask or what they're allowed to ask the prescribers. In addition, you have medications like, so Prestique is use a treat, anti-anxiety, antidepressant. To my knowledge at this point in time, and it's been this way for several years now, Prestique is like, Prozac has been around for forever. Everyone knows Prozac. Take a Prozac. Prestique is a newer medication, and to my knowledge, there is still no generic of that medication, which makes it really expensive, meaning some insurance companies are not going to want to pay for that medication. So Trintellix, which has been advertised, I feel like significantly. I see advertisements all the time for Trintellix. It used to be Brintellix, also a newer medication that switched to Trintellix, which it is now. To my knowledge, there still isn't a generic for that. ADHD wise, obviously everybody's heard of like Adderall and Concerta, some common ADHD medications. Vyvanse, to my knowledge, still does not have a generic. So you're going to pay a significant amount more for those medications like Vyvanse, Prestique, Trintellix than you're going to pay for Prozac or another medication, Effexor, which generic is venlafaxine. You're gonna be able to get that really, really cheap compared to these other medications that do not yet have a generic. So it's just so important to know this background story on medications, so that you are informed enough to ask the right questions. If you don't have the money, now for me personally, self-disclosure, Vyvanse really, 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 really works for me. I tried, now, and again, this could be a completely separate video. ADHD medications are classed into two different ways: stimulants, non-stimulants. So stimulants are going to be Adderall, Vyvanse. Non-stimulants are going to be Concerta, and I think Ritalin is in the non-stimulant category, but please don't quote me on that. But, so for me personally, Vyvanse works really, 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 really well. So I pay, even though there's not a generic for it, and it's really expensive, but it works. I think there also needs to be education on the fact that not every generic is the same. So Adderall, which is a stimulant, I'll often get, you can, if you ask, let me even back up even further. If you ask your psychiatrist, and I've done this before when I was able to afford it, I would have her check a box on her prescription pad that said I could only get name brand Adderall. And that she can do that. And they would prescribe that to me. But it would obviously be a hell of a lot more money than just getting the generic of Adderall. And a big reason for that for me personally was I feel like the generics of Adderall are really awful. And I've gotten generics from Adderall in the state of New Jersey and New York. A lot of times they're titled amphetamine salts. So they can kind of fill that medication with fillers that aren't great. There was one generic Adderall prescription that I got when I was living in New York for grad school, actually back in 2015, where I remember feeling so crazy and so like I was just like this, that I called and texted my best friend, who's now one of the best nurses in the Dallas kind of like Texas area. And I was like, I don't feel right. Like this generic is making me feel insane, because they're not all made the same. So that's another part of this like education piece that I feel like people need to know, is that not all generics are made the same. Unless you're getting a name brand drug, they could fill that with, they could fill the generics with whatever filler they really want to, and they're not all filled the same. So, you know, it's, but if that's all you can afford, then that's what you get. You know what I'm saying? Like, there's so much with big pharma that needs to be talked about, and especially when it comes to mental health. You know, all this long video to say, I saw a post that really disturbed me. And I just want people to know they can ask questions. If you want to message me, call me. Whatever form you want to reach me on, I may not know 100%, but I promise you I will find the answer if I don't know. Because I don't want people to have the wrong information. The fact that my friend was on Effexor for months, and she kept asking her doctor, her psychiatrist, why do I feel sick? Why do I feel nauseous? Why am I barely able to make it to work in a car drive without throwing up? And she thought she was crazy. And the doctor never told her, you know, and most meds don't work like that. You know, like you could take one med at 8, one med at 9, 10, like kind of give some wiggle room and you'd be fine. But with medications, especially anti-anxiety and antidepressants that have a very, very short half-life, you're going to go through withdrawal. and for Effexor particularly, those withdrawal side effects, I've heard from many people, they're so bad to the point where they don't want to experience them. I'll say it like that. Like, they're very bad. But these psychiatrists are neglecting to tell consumers that this is a part of their medication, or even educate them on short half-life versus long half-life. And there's nothing wrong with the drug necessarily that has a short half-life. It just means you need to be educated that if you're taking that medication at 8 o'clock at night, the next night maybe take it at 7:45. Next night take it at 7, like, so that it never really not metabolizes in your system. Like, so it never really leaves your system, because if it does, you're gonna feel really, really sick. You know, people need to know these things, and it may work very well for them. I think Prestige works very, very well for certain people and for a certain demographic, same as Effexor. I have yet to, like, Effexor, I don't think was ever being prescribed as much as it's being prescribed now. I have another friend who recently, their person prescribed the Effexor. I'm like, why is Effexor being prescribed so frequently? Because it wasn't really the drug of choice for a long time. It's not like, you know, so I'm seeing it used more and more and more. But at least if they're going to prescribe it, let your patients know potential side effects and what's going to happen. And so, I don't know, I feel very passionate about this issue. Please message me with any questions. I could make several videos stemming in subcategories from this one video, but I just wanted to put it out there so that people have some information. And I'm going to end with GeneSight. So GeneSight, GeneSight. It was a newer, I don't even know what you want to call it, modality, whatever you want to call it, a couple years ago. Now it's sort of, I feel like, not customary in practice because it was expensive at one point in time, but again, people don't know to ask for it. So GeneSight is a test you can take where you spit into like a little thing similar to like Ancestry or like any DNA type thing, and you'll get your results. So you'll see like which medications, it'll be like a green column, a yellow, and a red column. So you'll see which medications metabolize the best, kind of middle ground, and the worst. Again, it's not a perfect science. It's not like this is the end all be all and they found some perfect solution to figuring out what meds are going to work for you. But if you're very medication resistant, or you've tried so many medications and they haven't worked for you, I just feel like it's a really good potential roadmap to figuring out maybe why something hasn't worked, or maybe you need a microdose of something, or maybe you need a much higher dose of something that an average person wouldn't need because your body metabolizes it differently. Like, they'll show you that, and they break it down into categories like antidepressants, antipsychotics, ADHD meds. Like, they really give you a good breakdown. Now, a couple years ago, insurance was not paying for it at all, and it would cost upwards of $300 to get the test done. I'm seeing now more insurance companies paying for it, whether that's partially or in full. So it's just something to ask for, to kind of give yourself some idea, of where you might be on these spectrums. I also think certain disorders, respond better to medication management. If you have ADHD or anti-anxiety, I feel like there are meds out there that could potentially help you. Whereas if you have a personality disorder, there's no medication that's going to be a quick fix for that. But I still think that it's something to look into, that's available, that again, a lot of people don't know exists. Triggerfoot. So anyway, this is a very, 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 very long video that I did not anticipate on making right now, but I feel so passionate about it that I'm like, I can't not make it. There are so many videos, like sub videos I could make. If you guys have questions, please reach out. The best thing to do for yourselves is be informed and knowledgeable about what medications you're on, your prescribers, do research. There's so much out. Like, I have a friend who just went recently to see a social worker, and he has to go through his insurance. So the insurance chooses who they see. And we had dinner, and they told me about the kind of like the first encounter, and I'm like, oh my God, like I just want to shake these social workers and these prescribers, and I'm just like, this is crazy to me, so I'm not saying the best. I don't want to put that out there, but I feel like I've had enough experience in the most acute settings to see some of the most severe cases in all of these things. And I've been so fortunate and blessed to work alongside some of the best people in this field who have taught me about medication. And in my job as social work, it's not really, most social workers don't learn about it because we don't prescribe medication, but I've been fortunate to work alongside all of these, collaborative professionals. And so I've learned, and I've been lucky enough to work in these settings where it's kind of been forced upon me to learn about medications and what they do, and prescriptions, and the different classes of medications and how they interact with the body and the brain, and just, so I feel like I have a little bit of a step up from, maybe the typical person. But again, this video is really long, and I'm sorry for that. So for anybody who's watched it, thank you. But please reach out if you have questions. And I wish everyone well, and I will talk to you maybe in another video. All right, bye.